want to thank you for being here. My name is Elena Rios. I'm President and CEO of the National Hispanic Medical Association. We're here to discuss healthcare reform implementation for the Hispanic community. And I just wanted to say a few words. I wanted to give you the challenges as set forward by our chairman, Dr. Cyril Sumaya, who couldn't be here. The Hispanic population right now is 52 million people in the country, and 16%, according to last week's census release. We're now the largest ethnic group in the nation with the greatest proportion of uninsured, and we're the group that stands to gain the most. So here's some challenges from our chairman. One, there needs to be greater health literacy and development of more appropriate utilization of all services, prevention, oral health, mental health, and reforming our health system. Two, there needs to be a recognition that our Hispanics who are undereducated, underserved, need to have a better ability and education on how to choose health insurance. And traditionally, they have always been the ones with the lowest enrollment rates. Three, there needs to be a better trust in the healthcare workforce that's set up. Our healthcare workforce is not racially, ethnically diverse, is not culturally competent to deal with Hispanics, and that's been a long-standing problem. Four, we need to have an assurance that our semi-skilled laborers, our blue-collar workers, the Hispanics who make up so many of these workers, have adequate health care attention at the job to learn about their new health care services. Next, there really needs to be more providers, more individuals, more organizations that are interested in helping Medicaid and Medicare and CHIP and serving in these public programs and in the new insurance programs set up. Lastly, there really needs to be more attention paid to our underserved neighborhoods and communities in our rural healthcare settings for better research so that we do have data collection under healthcare reform that can make a difference to change healthcare for our communities. And then lastly, the challenge from Dr. Sumaya is really about leadership. There is a recalcitrant underrepresentation of Hispanics in decision-making positions, and the administration in the entire health enterprise, academia, healthcare in the public sector, hospitals, policy groups, professional societies, the federal government, the state government, and we really need to take a look at all of these challenges. So the Affordable Care Act was passed into law by President Obama on March 23rd, 2010. It is the most comprehensive set of policies, a framework that will increase affordable insurance to 32 million Americans. And like I said earlier, Hispanics are the greatest group, the group to gain the most if we do this implementation right. And we're going to hear from our speakers here about what that means. In terms of access, we know that means having more affordable insurance, having increase in clinics, having medical homes that are part of clinics with a referral system in our communities. We need to have incentives for small business that small businesses can really work with, tax credits, healthcare exchanges. We're happy that the healthcare exchange will include Puerto Rico, but we also need to know, well, what does it mean to have grant programs with community health workers, and who are those community health workers? And we also need language services that are paid for and reimbursed in our system. That's all access. In terms of quality, the biggest change that we look forward to is this new value-based performance measures. For us, lots of diabetics in our families, in our communities, instead of getting paid, our doctors, our nurses, our hospitals, instead of getting paid by how many times you see the patient or how many lab tests you order, there's going to be a system put in place where the payments will be based on how well you took care of that diabetic. Let's say over a quarter that you were able to refer them to the ophthalmologist or the podiatrist, or you were able to have appropriate sugar levels. That's the value-based care that our providers and our communities need to know about and need to understand how we can change those measures, adjust those measures to include what we call cultural competence. We also know that health information technology has been started by the Department of Health and Human Services through a vast network of regional centers. We want to be sure that the Hispanic doctors and the doctors who take care of Hispanic patients get the new incentives from the health insurance system, health information technology system. 3, in terms of prevention, there's a brand new national agenda. The first report just came out. We now know that the National Council for Prevention, Health Promotion, and Public Health wants us all to focus on 4 diseases: heart disease, stroke, cancer, COPD, and injuries. And we need to make sure that, again, the injuries are seen within the occupations that Hispanics work in, for example. And we also know that the social determinants of health and the new concept of health equity and priority populations is going to be more and more a bigger focus. We're kind of losing the focus on minority health, but we're here to hear from Dr. Garth Graham, who will talk to us about that. And then lastly, in terms of workforce, we're also very happy to hear from the Associate Director of HRSA for all of the Bureau of Health Professions. And this Affordable Care Act supports the expansion of diversity in all the health professions, as well as allied health, the oral health, the mental health, all of the public health, not just the doctors and nurses, but we really need to understand that we have a tremendous opportunity to help this administration start focusing on our communities, for our students to get into the pipelines and the pathways to become doctors, nurses, and public health persons. And I think what's needed, and I'll just end here, in conclusion, we really need a more targeted approach to help the Hispanic community in this country, because if 1 out of 4 Americans are Hispanic in our lifetime, in the next 20 years, 1 out of 4 Americans are going to be Hispanic. If we focus on the Hispanic community and come up with the more appropriate mechanisms to help those communities deal with health in their communities and in the doctor's office, then we'll have a healthier America.